Is this case a case of dermoid or endometrioma? The following images were seen in a 55-year-old multipara who presented with lower abdominal pain and swelling. So look at the still images on trans-abdominal and trans-vaginal images. Look at this lesion, which one would describe as ground glass appearance. I remember ground glass appearance is seen about 50% of endometriomas and is one of the benign simple descriptions if seen in premenopausal women is suggestive of endometrioma. But remember, this was in the 55-year-old, so she is postmenopausal. So look at this still image on transabdominal here. Look at the size, more than 10 divided its diameter. So one cannot even use the modified simple descriptors here. On transvaginal imaging, look at this ground glass appearance. But somewhere here you can see the extensive shadowing. Shadowing can also be seen in endometriomas, especially within the walls, called calcific stapling. But occasionally one can also see some form of shadowing in endometrioma. But here, what gives this away is this fat area here, and this area with this intense acoustic shadows. This is what is described as the tip of the iceberg, which is a feature of mature cystic teratoma. This is a dual image on transvaginal imaging. So now let's look at the transabdominal video. You see the bladder here. You can see the ground glass appearance, not the large unilocular cysts, and not this shadowing here. Look at this shadowing. And in the center here, you can see these echogenic areas. So you can see this lesion has mixed echogenicity with shadowing. And this is a feature of dermoid, not endometrioma. But at times, these things could be confusing, really. So it's important to describe exactly one observes on ultrasound and give differential diagnosis. So look at the histology. The pathology showed me that this actually thyroid tissue. So diagnosis, mature cystic teratoma. So what is the take-home message? The take-home message is that one should not rely on a still image to make a diagnosis of either dermoid, endometrioma, or any lesion for that matter. Secondly, we should remember that the ground glass appearance is seen in only 50% of cases of endometrioma. So in the other 50%, the appearance may not be ground glass appearance. But generally, don't just look at the still image. Also look at the bigger picture so that one can make the correct diagnosis. Thank you very much for listening.